How's it going? I'm Kyle Smerglia. I'm going to be presenting the report of findings that we found for you.
Okay.
So initially you came in with some low back pain, so that's going to be your main complaint right here. Throughout the case history, we found out that people in your family have had piriformis syndrome, is where the muscle actually impinges the sciatic nerve.
Okay.
And you've actually had this problem in the past, so that might be a reason that you're having the pain that you are. During our physical exam, we did a couple orthopedic tests that actually were positive for something wrong in your low back region. It was the positive for a straight leg raiser and the Lesag's test. And then upon palpation during the physical exam, we found that you had a low back lumbar swelling. So then, right here, you can see in the pictures, we found that on palpation, the swelling was like right here. This is your hips, and this is your spine. So like low in your spine, we found the swelling, and then we also found that your left hip is lower than your right hip. Everything cervical, you were fine, checked out, no problems. But then again, we've seen that we have a little discrepancy here down in your lower back pelvis region.
Okay.
Alright? And then right here, this is pretty much just showing how the nerve systems work. Each intervertebral foramen has a nerve coming out of it in your back, and when those bones move out of place, it impinges on the nerve, and that pressure on the nerve causes things to hurt or not function properly. So since we found something in your low back region, possibly this could be happening down there. Okay? And then because of issues like this, you're going to have compensation. So you might have a muscle spasm on one side, you might have muscle weakness on the other side, because you're compensating for that pain and you're getting in the most comfortable spot. And then here is the different phases that you could be in, as best phase number 1, worst phase number 3 here. From what we found, you're still in phase 1. You don't have anything really that badly wrong, just a little out of place. Okay? And then, again, this is just showing the different phases. Here's normal, and here's the worst phase where things are calcified and there's quite a few problems, and you can see the difference from the two. You're right here in phase 1, so not that bad. Okay, and then what I realized is with this type of issue, I think we should meet 3 times a week for 1 month. See how everything's going, we'll reevaluate, but if everything's going as scheduled, we'll just meet 1 time per week for 3 months. And then after that, hopefully we solve the pain and the problem, and we can start a wellness care once every 2 weeks for however long you'd like.
Okay.
Alright? And then we're going to do our reevaluation in 1 month from this visit.
Okay.
Alright? And then this is just talking about your visits at our office. Once care is begun, it depends. Once the care is begun, it depends on different variables like age, gender, lifestyle, all these aspects of your life. So saying that we're going to get you better in a month isn't the same for everyone. Those are expectations, but probably not exact. It could take 2 months, it could take 3 weeks. It's hard to say. And that was your report of findings.
All right. Well, thank you.